to welcome our panel members to the stage for another live and interactive discussion with
Okay.
aging life care managers. And for me, these discussions are amazing because as consumers, when are we going to get to talk to three aging life care managers all at once, have their undivided attention? These discussions are amazing. And folks, be thinking about questions or comments or things that you'd like to share. But first off, thanks to all of you for taking the time to join us this month for our roundtable. And what I like to do first is just get to know the three of you. So, how about we start with with Megan, and then I'll go to Marie, and then Soni. So, Megan, tell us a little bit about your background and what led you to becoming an aging life care manager.
So, when I was in college for nursing, my grandfather was a physician and he retired. And he and my grandmother both had some problems about that time, and I was influential in their care. So, what I discovered that later, much later, that I was already doing care management. I went to school for nursing. I got a master's degree in nursing and did some other things along the way that really well prepared me for what we're doing now: home health care, a nursing home. I worked in the hospital first. So I feel like I've kind of done all of the different things that we help navigate people through. And so here I am 15 years later. We started a company 15 years ago.
I love it. All right. Thanks so much, Megan. And folks, that's not a fake background that we're seeing of Megan. She's actually like out on her porch. I love it.
You'll see the
Um,
birds.
yeah. Okay. Now, Marie, tell us a little bit about your background.
I'm with Independent U, and we are in Northern Virginia, and I am a nurse, and I worked emergency room, home health, and then private duty. And you realize you're just putting a Band-Aid on a gaping wound. You're doing a safe discharge, but then that all falls apart. So care management just was a natural progression to do care management, to be the person that pulls it all together. So, and to stop that gaping wound from getting worse.
I love it. All right. And last but not least, Sony, tell us a little bit about yourself and your background.
Well, I'm Soni. I'm the owner of Aging Advisors, and we're a care management agency in Mercer County, New Jersey. So that's Central Jersey, close to Princeton. I got into care management because I worked as an aide in an assisted living when I was in college, and I really liked the population. I went to University of Michigan. They had a PhD program there, so they let me take classes in the grad school. I went on later to get my master's in gerontology in New York, and I answered an ad in the paper because I'm old. And I got a job with a care management company 25 years ago in the city. And when I moved, I worked at a senior center and within a nursing home to gain my knowledge base. And then I took over an existing agency.
Oh, wow. No, this is great. Okay. So now, Sony, since I'm talking to you, I don't want to put you on the spot, but I like to define, there's a lot of people tuned into this discussion today that have never heard of aging life care. They don't know what it is. So before we dive into our discussion, would you like to take a crack at giving us a definition of the of what is aging life care?
I will try my best. I am the New Jersey chapter Aging Life Care president, so I've been involved for quite a while. Aging Life Care Association is really an association of geriatric care managers who are really advocating for adults and their families. We take a holistic approach. It is a non-referral fee-based service, and we have a standards of practice that we abide by that really is outlining that our goal is for the client and what their goals are. And we will do whatever is in our scope. And luckily with care management, we can get very involved to do that. So we help seniors, we help older adults. Some practices focus on older adults, adults with disabilities, and their families.
I love it. Wow, you did a great job of defining that. And I cut and pasted off the website and the link for folks to dive in and learn a little bit more. A couple of little housekeeping things before we move into our roundtable discussion. let me share my screen because folks, so Megan and Marie are aging life care managers that serve Northern Virginia. Soni serves the Pennsylvania, New Jersey, New York region. But I want to show you how easy it is to whoops, how easy it is to find an aging life care manager anywhere in the country, and they are anywhere and everywhere in the country. So when you go to the aginglifecare.org website, you'll see an orange button at the top. It says find an aging life care expert. You click on that and then scroll down, and you can throw in your zip code, your loved one's zip code, your sister's zip code because you're helping her, you know, find something. And you click find, and then you will have a nice list that will come up. And oh, look at that, Megan, you're first on the list for I typed
Preston.
in
Yeah.
my zip code in Northern Virginia, and you'll see countless aging life care managers out there. And so I hope that's helpful. And then you know, Sony, since I'm on my screen here, how about before we transition to the discussion, it seems like this slide, the ALCA 8 knowledge areas, always is something that we talk about in these discussions. Uh, would any of you like to kind of comment on this graphic here?
Well, these are the areas that we always cover, and we're looking at the holistic, the whole client, so we're not going in only looking at their health and what the crisis is now, but we're looking at what their finances are. Are they in the right living situation? Are they using all the local resources that they use? Family dynamics and family dynamics where half the family think mom should do this and the other half don't think. So we get into the family dynamics on what is best for the client. And we advocate for them with the family, with the doctors, with the health system, with Medicaid, Medicare, insurance, we do all the advocate and the legal to make sure they got their wills and
I
their
love
power
it.
of attorneys. There are so many people who I see, they don't have wills and
Mhm.
you're scrambling and they're 85 years old.
Yeah, yeah. No, I agree. Yeah. So, all right. Well, thanks. Okay. So I think we covered all our housekeeping. So now we get to jump in to what I like best is hearing what's on your all's mind and sharing case studies, trends, things of that nature. Let me go back to Megan because you were first on my little Brady Bunch thing here. Megan, what's on your mind? Anything that you'd like to share with our community?
Well, so a trend that we're seeing, we're 10 care managers, and just in the last month, we've seen at least 4 situations where people just hadn't planned ahead. And either they failed to plan at all, and so we were brought in a crisis. Or in one case, this family, they planned very well, but they didn't give the information to the people they were going to rely on to help them when it was time. And they aged in place and lost contact with their loved ones altogether. And so they ended up in a hospital, and the hospital had to search to see if there was a family member anywhere, and eventually they were found. But then another situation where there was some planning, but the primary caregiver died, and the rest of the family didn't have copies of the power of attorney documents. They didn't know what the plan was. So they're scrambling to create a plan for this loved one who has dementia. So the moral of the story we're finding is people really need to plan. They need to communicate with whoever they're identifying as their agent, so they know what they're expected to do and have agreed to do it. And then stay in touch with those people.
It's a lot of work, and it's not something that people are it, we've all got sort of fears in talking and thinking about this, but what I've found is that so many people have legal documentation put together, wills, trust, advanced care planning, but
Right.
the only person that they've had the conversation with is their attorney.
Right.
And I actually think it's more important to have the conversations with your support network with no legal documentation. We want both, but folks, hopefully that can be helpful. But I'll tell you what, signing on an aging life care manager to your team in advance can be a nice wingman to help you through what can be somewhat of an uncomfortable journey. So thanks for bringing that up,
Well, I
Megan.
wanted to
Very
add
important.
to Megan's
Yeah.
point that sometimes when we go in for the assessment, we realize that the person they've appointed, because I do ask to see the documents, like a spouse gets diagnosed with dementia and they haven't changed their paperwork. And I say, do you think your partner can dial the phone for 911? And if the answer is no, then you need to update your paperwork
Right.
because
That's a
people
good
don't
one.
think
I've
about
never
it.
heard that one before, Sony. Um, okay, this is great. And guys, keep the questions coming in. We'll get to them. I want to just make sure we get through this round of tips, and then we'll start hitting those. Marie, what's on your mind these days? Any words of wisdom to share?
I agree with Megan, planning ahead. And recently I've had two cases where older adults, 80s, 90s, have a developmentally disabled adult living with them who's never maybe went to school, but has never worked outside the home, has never lived anywhere else but with family, and they don't have a plan of what they're going to do. And, I had one case where all the living family outlived them.
Hmm.
So, and then you have to find a place when someone has been living with family their whole entire life. So you would think that in today's age, this would not be happening, but it does happen. And so to make a plan, to get ready, what are you going to do with your disabled child now that they're 70 and you're 90? Yeah.
Yeah. I heard, I had a heartbreaking story, and I'm going to try to find it and drop it into chat. But it was a situation where an adult child who was, I believe, 45, in a wheelchair. Mom and dad were in their 80s, and as a family, they realized, okay, we need more support. We need to move to assisted living. And uh, the adult daughter, who happened to be an attorney in a wheelchair, uh, called around helping mom and dad. It took 20 communities before one said, "We will take you and your mom and dad." All the calls were like, "We would take
Yes.
mom and dad because of the age restriction that we have
Mhm.
here."
Right.
And it was a crazy
Very
story.
difficult.
Yeah,
Yeah.
so we need to change the culture. Also, I'm dropping into chat, folks, if this resonates with you. I didn't know this, but there's an association of aging with developmental disabilities. And I discovered them not too long ago. I was like, man, what a brilliant, very supportive association. Great point, Marie. Now, Sony, back to you. What's on your mind? What would you like to share with us today?
Well, I'm going to quickly answer Anne's question online about whether any of the panelists have a specific area of specialization, and she listed some, but I would say that any of us on the panel would address all of those items because we really do have the holistic approach. I don't know if that's the answer you were looking for, but I would say any of those items that were listed about advocacy, well-being, helping people find senior communities are all things that we cover. I was saying that I've been noticing actually in my practice a few more older adults who are trying to plan ahead so that they don't have to burden their children. So they're looking for an advocate or a partner to kind of touch base. I had a client, she said, my husband's home, I'm older. If I go in the hospital, I want someone to know he's home alone. Over time, he needed more needs. There was education on home care and then live in and how to navigate that live in because she was also having some trouble adjusting to someone in her house. We had a whole plan for what would happen to her husband from the minute if she passed. Then her sister-in-law said, in the case of your unfortunate demise, which was very upsetting to her. And I said, don't worry, we already have a plan. It's all written out. Unfortunately, her husband passed first. She had a daily money manager. We had activated her long-term care policy for her husband, but she still called me. She said, he died and I don't know what to do. So I went there at 11 o'clock at night and called the funeral home and did all the calls in the morning and, worked with the medical equipment and educated the family so that when the family was in town, they could step in completely. And it really just let her focus one on her own health and then on her grieving process. So I do say for more seniors who are realizing that they might need help, but not yet, I think it's very wise that they already have a plan to avoid what Megan is saying, where if somebody gets stuck.
What I like about your story, Soni, is that it shows the timeline of a client and the fact that they had the foresight to contact you in advance so that you were there through all of those challenges. And that's something that I'm really encouraged about, is that this topic of solo aging is now not something that people are shy about discussing. And it's so exciting to see for the first time in my 35 year career, more movement towards contacting aging life care managers while you're healthy and active, and just having that wingman or wing woman or quarterback or wedding planner to help you through life's journey.
Yeah.
This is
Always
great.
try to say the what ifs, because if you have a couple planning or somebody that has a designated person, I said, well, what is your plan if one of you dies first? Well, they always look at me like deer in the headlight. They go, well, I wouldn't stay home, or I wouldn't stay here. I would move here. I said, you need to think about that. You need to plan for that. You need to think about that ahead.
And I
I
came up
think
with a booklet for my clients that also has the basics, like what is your iPhone password? Because if somebody has to get into your account, they're going to get a verification. And who is your, auto insurance policy? And then on the back page, I have all the things for the funeral because, a death certificate requires knowledge of your parents' name and your mom's maiden name. Well, I had a client that was 95. That was hard to dig up. So trying to keep people planning that way all the way through from start to finish.
All right. This is great. Great resources. Great way to kick off the discussion. Now we got a pile of questions we're going to get through.
Okay.
Denise says, if you can't find original documents that existed, are they considered non-existent? So if somebody had healthcare power of attorney, but nobody can find it, I I think Denise is right. It doesn't exist.
Right.
Any of you have any insights on that?
No,
I
it's
agree.
right. You can't
if-
find it, it doesn't exist.
No.
And we
Okay.
just had a situation where someone was living in independent living in a community, in an Erickson community. She was determined to not have capacity by two doctors. Her brother, who was her POA, just died. And so basically there was no one to have authority to help her and ensure her well-being. And so we proceeded to work with the team that she has, her support system, to get a guardian conservator. And then we discovered there was a power of attorney document in her apartment, and it had a successor, which was a huge surprise to all of us. But her successor is her nephew in England, who is almost impossible to reach by phone or by email, and hasn't seen her in 20 years. So yeah, those documents are so important, and knowing where they are is so important.
No, that's great. And Megan, I'm also glad that you brought up guardianship, because and do all three of you have all three of you worked with guardian cases where like a court or somebody else is appointing somebody as their guardian?
I will say
Yes.
that we've done assessments as care managers to see if somebody is able to return back home because we don't do the medical assessment of their cognitive function, but we might be brought in to say, yes, this person can return. No, they can't. We get hired by guardians who want to have eyes and ears on their person, but they are not the person who can do that. So right now we have a client who has a guardian who's been in the ER and now he's at rehab, and we did all of that, and we just keep her updated so she can make sure that she is doing the best she can for him.
Okay, and Dagmar says, make sure not to only have a power of attorney, but have a durable power of attorney. The power of attorney is invalid as soon as someone has dementia. And I did a little search here, and it says you're correct. A regular power of attorney generally becomes invalid as soon as the person who granted it becomes incapacitated. Um, so Denise says it's important to have a successor for POAs. Yeah, and that's a challenge that we hear a lot of is that folks have assigned proxies, but they're concerned because their proxies are their cohort who might are their same age as opposed to they may pass at some point and you need to find a new proxy.
Right.
Let's see. Joe says communication with family is vital. An example may be that they already have long-term care insurance, but the adult children don't know about it
Right.
and they're writing checks. And I'm glad Joe brought this up. Tell us how you all work in the world of long-term care insurance. This is do you help people review their policies, help them gain access? And does long-term care insurance ever pay for aging life care services?
So from my experience, we help people initiate their benefits, and we do an assessment initially with all of our clients anyway. And so that helps us know whether they qualify for the benefit, first of all. And in some instances, we have people that are so independent, fiercely independent, that while they need help, they're not accepting help yet. And so we have to explain to them that they will get the benefit if they would just allow the help. Because the insurance company isn't going to pay someone who needs the help but isn't getting the help. They're paying for the help. And so we help initiate benefits. We will help them fight situations where they're denied their benefit. We've never been unsuccessful at getting those straightened out. So yeah, and in terms of paying for it, we have a John Hancock policy with a couple of clients that will pay for an assessment, and they'll pay up to $3,000 a year for care management activities. They don't call it care management, but when you look at the definition of their terms, it qualifies. And so when the paperwork's submitted, they will reimburse the client.
And
Oh,
Genworth
great.
is a little bit more liberal on their care management services. So my clients, John Hancock, I think is $3,900 a year. But some of my clients on Genworth, they do scrutinize that invoice pretty closely, but they seem to be covering the care management, especially if we overlap with medical appointments.
Great. I love it. Okay. Let's see here. Okay. Beverly says, how do folks find out that organizations such as yours even exist? I have been serving in the older adult world for years and never knew that your services existed. Well, that's why I'm doing these monthly webinars, Beverly. How do they work? Folks find themselves needing to care for an older adult and don't know what to do. Now, I'm interested in our panel's discussion on this, Beverly, but this is what I'm referring to about my discussion next week, and I'm not ready yet. What I've found is that folks kind of tune out anything related to aging or disability or services. The messages are out there, but we're kind of blind to them until that day when we need the services. And that's why I guarantee all three of you have been at cocktail parties and you're telling somebody, or a barbecue, and you're telling somebody what you do. And it's like, oh, I wish I knew that existed when my mom was around. Well, aging life care has been around for over 35 years, folks. This stuff has been out there. But Beverly, your question is well founded, for sure. And that's why we're trying to heighten the awareness of aging life care.
I
Um,
think the challenge for care managers is that if you try and advertise, people think you're a home care agency.
Yes.
So a lot of us rely on referrals. So sometimes that means like a lawyer, a home care agency, a friend, a neighbor. Past clients have been the ones to make the recommendation because it's such a wide scope of services. I mean, I've had to remove someone's dog. It just everything, things you wouldn't even imagine that we're doing. How do you put that on an advertisement or a piece of paper?
yeah,
And I
no,
think the
it's
word care management is thrown around a lot. I mean, I see aides in facilities that are called care managers. I see wellness nurses called care managers. And the difference is that we are certified. It's not easy to become a care manager, to go through the process of applying, getting certified, our different levels of certifications, how much experience we've had. Do we have a degree in a aging related field? So we are certified care managers. And when you go to Alka and to our website, you know that we're vetted. You know that we have, been certified, and we have the experience.
Yeah.
all right. Okay, Isla, she says, what about if there's a will that's 25 years old, outdated in terms of financial POA, power of attorney? Can any attorney be consulted on the new will, or does the previous attorney have to update it? Isla, um, any attorney can do that. If you do have, if you can contact the original attorney, you might benefit from sort of a lower cost of drafting as opposed to redrafting. But any attorney, if you bring that in, and in general, if the language is you're in agreement with it, you just need to change the names. You might save a little bit in your legal fees there. Um, Okay, where are we at here? Okay, Dixie says, can you describe group home options in your area versus life plan, value, cost, and client preferences? In the DC area, many folks need to hire additional private care at CCRCs and life plan communities versus smaller residential communities, which may meet their needs. Okay, so I think synthesizing Dixie's question, there's a lot of folks that have mom or they live in a larger community, and the management says, hey, you need to hire an external home care provider to stay here in a safe environment. Could you all speak to some of that and and also speak to smaller residential assisted livings, the pros and cons of that option?
Well, in my experience, I think it has a lot to do with the ratio. So in this area in Northern Virginia, the regulations are that a new community, a new group home type of community wouldn't have more than 8 people in it. And so the ratio of staff to residents is going to be better than in a larger facility. So that helps in terms of not needing to bring in private duty care for as much. Sometimes you still do, but for very specific reasons. And I think also that they get to know their residents so well because it's just a smaller group of people. And there are some people that like the smaller environment, whereas other people like more activity, more people around, more activity, more space to enjoy public spaces. So there's kind of a huge difference in terms of the level of activity and dynamicness. And so people they find the right place, whether it's the smaller
Mhm.
place or the
Mhm.
larger space.
And we have some
Um,
CCRCs here that have the independent, the assisted living, the memory, and the healthcare skilled nursing. It's not always the right place for everybody. If you already know you
Mhm.
need services or one partner needs services, then the recommendation would be go straight to assisted living because you're already going to have those services that can come in and out of your room. Some people who go to independent living, there's the big buy-in in the CCRC, and then they don't want to give up their beautiful 2-bedroom apartment with a full kitchen to go downstairs where all their friends are going to see that they're in an assisted living with, a studio. So when we're making that decision, it's always, like Megan said, community, but also what are the needs expected? Because if you're just going to move there and get an aide and stay in your apartment, then is that a better alternative than staying home? A lot of that has to be evaluated.
Yeah.
Yeah, having, a lot of this comes back to just very transparent, open, frank conversations and being able to address the answers that sometimes we don't want to hear. And to Dixie's question, oftentimes when I hear the cases of the home care coming in, more often than not, it's like what Sony was talking about is that mom didn't want to leave independent living. She didn't want to go to memory care or assisted living. And this was the choice that was presented to her. Now, Sony, you had referenced a booklet and questions, that you had. Barbara was wondering if that's available to us.
Yeah, it's just a packet that you can print out. I don't know how to, it is
Is it
lengthy.
on
I
your
don't know how to
website?
put it on the chat. It's not, but
Oh, okay. Here,
I
I tell you
can
what.
send it out if you want it. It's not I've just made it because I find that too many of my clients, like I had a client whose husband was passing, and I said, it's a second marriage. There's things in everybody's name. I took pictures of all the bills. I made her a spreadsheet. I said, so when he passes, you'll know which accounts to change, which names to change, so you will be prepared. And that kind of spurred this packet of information so that everybody
Great.
has it. And then you can keep it on the side and let your power of attorney know when something happens, this is where it is.
Okay, cool. Folks, I'm just dropping all three of our panelists' emails in chat. And so if you would like that packet, reach out to Sony and then maybe she can send it to you. Okay. All right. Oh, let's see. Yang Pang, great name, and I hope I pronounced it. Yang Ping, okay, says, what is the difference between a care manager and a certified care manager? Great question, Yang Ping. Anybody
Well,
want
the
to take that one?
we have certification, the exams that we take. We can, I'm a CCM, certified care manager. It's an exam I take. I have so many CEUs that I have to do and to recertify. And there's also there's another one, but then there's also all the licensed social workers too. So we are certified by exam.
Okay.
So
And I'm dropping,
when I hire care managers, I only hire them if they're qualified to eventually become certified. And usually it takes 2 years of full-time experience, depending on what the educational background is. And so it's a real commitment to a level of quality. There's so
Right.
many people that have taken care of someone, and so they feel like they really understand it all. And the thing is, you don't know what you don't know. And so by the time you have been a care manager full-time for 2 years, taken the test, and then continue with the ongoing education that's required every 3 years, you know that somebody has a really strong foundation.
all right. Okay, let's see. Kat says, what questions should you ask when interviewing an aging life care manager? The client is giving power to that person over, and is the client giving power to that person over life and death matters? Now, key distinction here, aging life care, you can hire an aging life care manager that is not your power of attorney. A power of attorney is what would make a person that would make decisions with you. Kat, I'm going to drop into chat a article that we put together on questions that you can ask when interviewing aging life care managers. But while I'm doing that, does any of the panel have any insights on Kat's question regarding questions to ask and power of attorney? And do any of your practices um, serve as power of attorney or healthcare power of attorney if somebody requested it?
We
I
do.
do serve as healthcare power of attorney if there is a lawyer involved. If
Mhm.
I've spoken to the lawyer, if the lawyer has involved me from the beginning, if I know that there's no other family that won't be involved, but I do not do the financial power of attorney. I really like to have that partnership and the separation between the two of us.
Same with us. That's exactly how we handle it too.
Yeah, and I believe that like the bylaws of aging life care prevent you all from delivering services and having a financial power of attorney. But what's interesting, Sony, um, for those solo agers out there that don't have a healthcare or financial proxy, the example that Sony is sharing of where you've got an aging life care manager as your healthcare power of attorney, and you've got an elder law attorney who's doing financial power of attorney, that checks and balances and working together is to me seems about the most appropriate way if you've got to pay to have these proxy services.
I do want to
So,
say that there are practices that do serve as power of attorney or guardians. It's not my
oh wow.
practice, but I do know that there are some. It might be a different division. They might have different insurance. But if we don't have an elder law attorney, then there are fiduciaries, there are daily money managers that will be power of attorneys. But I did want to outline it because I do know a practice that does offer that.
Okay, I didn't realize that. And folks, at the end of the day, if when we talk about proxies, the most important thing is trust in a relationship. So just
Mhm.
because like a fiduciary says, "Oh, hey, we'll be your financial power of attorney," I, I implore you to take them out to lunch 2 or 3 times before you sign that agreement. Like, develop a relationship. This is a very important job, and my concern is that there could be some. Well, we've already seen that I think there was a movie made about this where a law firm had a bunch of financial power of attorneys. So really invest in creating that relationship, you know. So okay. Where are we at here? Sorry. Okay. Beverly says, what is the payment process for securing your organization services? All right, Beverly, I told these care managers sooner or later somebody's going to ask,
Mhm.
how much does this cost and how do payments work out?
The payment is it's private pay unless you have a long-term care policy that will cover care management. So it's private pay and the price varies according to region. It's going to be more expensive in, New York City than it's going to be in Ohio. So when you're looking at for a care manager, on the website too, there's questions that you could ask, but talk to them, talk to a couple ones. Who really feels like the best fit for you and the best fit for your situation, because it's a very close relationship that you have with them. It's a very trusting relationship. You're putting the life of your loved one in their hands and, with the decisions. So interview a few, don't go with the first one that you find, and ask about pricing, ask about travel costs, ask about, different, things, mileage. Do they charge mileage?
Yeah, and another thing that's come up quite a few times, not only in talking to aging life care managers, but elder law attorneys too, is folks like if you hear like an hourly rate, and I believe most practices charge an hourly rate, at first glance, it's sort of like, oh, wow, I can't afford that. Talk to the practice about your concerns and your financial budget or what have you. I have never had anybody on this panel that didn't say, we try to work with people within their means, and it might be us more coaching versus doing, but we're going to be there. And I think the coaching and just having somebody, folks, that you can call up and say, Mom just had a fall and I'm at the hospital. What should I do? Well worth the money for those, especially in a crisis situation.
I was just telling our panelists that if somebody says, wow, it's a lot of money, but I can tell you everything about what's going on in all the facilities in my area, who's good, who's not, what home care agency to call. I had a client, my air conditioning went out. I had an electrician there right away. Were you able to get units? Like that time that you would spend trying to locate and read the reviews and talk to people and not even know what to trust, that is the value of your time that you're paying for.
Mm-hmm. I agree. And where another area, like let's say that you all help a family make a move into an assisted living, um, just having you as an advocate, if something goes wrong, if your expectations aren't met, having the aging life care manager by your side, talking to management and figuring out, what are the next steps can be very powerful. These folks in our field are viewed as rock stars by all the providers because they know you all are working with multiple clients, and it's great leverage to have if things are not going right.
And it's just
And we're
invaluable to have a aging life care manager advocate you when you're hospitalized, when
Mhm,
you're in a facility, when
exactly.
you're in an emergency room. That's those times when if you have pre-planned and you have a relationship with us, then we can just walk in, talk to the emergency room doc, and plan everything and advocate for you.
I love it. Okay, Joanna, Sony, I think you were talking about a John Hancock. Somebody was talking about the John Hancock policy,
Mhm.
um, and what aging life care is referred to on a John Hancock policy. Did Joanne may have heard that?
I think it was Megan, but I think
Oh,
in one of the policies it said care coordination was one of
ah,
them.
okay.
If you read what the description is, it'll say assessment or, it does have a definition. You just have to read your policy on what's covered.
Mhm.
But it might be not, it's not aging life care management, care coordination, and then you can get it work it. Yeah, yeah, that was right, Megan. You're the one that brought that up, that you can work to get that covered on their policy. Um, okay. Uh, okay. Dagmar, if your loved one dies, whom to call? 911 or whom to call? Get an elder attorney. All right. Well, Dagmar, if you want to clarify that one more, we'll jump into that. Um, let's see. Um, and and again, another question, what do you charge, or some of your services free? It's been my experience that most aging life care managers will do about a 30-minute free assessment and conversation. Is that true with all of your practices?
Yes. Yeah.
And that's an opportunity for them to know whether it's a two-way street, figuring out if you're an appropriate client or your loved one is appropriate client. And but I will tell you, oftentimes you can learn a lot in that 30-minute conversation. That I've heard many people that had that 30-minute conversation with y'all, and it's sort of like just gave them peace of mind that,
Mhm.
so. Um, all right. Another certifying body for aging life care managers, this is from Gladys, is the International Commission on Healthcare Certification. Uh, and so she's got the link there. Um, let's see. Maya says, how do you build a level of trust with your clients, especially Sony?
I'm not
But
going to
yeah,
take that only because I know that Marie and Megan and some of our audience are care managers too. But I do say that a care manager does not come in as the boss of you. We have no vested interest to make you move or to refer a certain service. So I think even when we've walked in cases where people are, very timid and nervous and they feel like someone's forcing them to see us, I think when they, at least in my practice, and I think for most, it's just a conversation, that first assessment. We're all experienced enough to get the information we need from that assessment in their home. It doesn't have to be like a drilling of all of this and really learning about them, because often we need to go back and think about what recommendations we're going to make too. And I think that, we all try and match the right personalities to clients and skills. But my experience is when they know that you're a partner and not another person telling them what to do, it really does develop into something trustworthy.
And adding to that, what they're looking for is their options. And so when we have a soft approach and have a conversation and they're not feeling challenged by it, then what they want to know in the end is that discussion about what their options are so that they can begin to formulate a plan, whether it's with us or without us. Our first assessment may just be a consultation and not turn into ongoing care management, but usually it does. And even if the first interaction provides enough information that, say, the adult children feel like they can carry it on for a while, they call you back in 6 months and you give them a reason to. You say, these are the things you can anticipate coming up, and please just feel free to call us when that happens, and we'll do this again. Eventually it ends up being ongoing care management, usually.
I love it. Okay, let's see. Some elder law offices have care managers in the practice as well. Are you all familiar with any that have aging life care in their practices?
Some of the bigger cities I've seen do have care managers in them, but it's been a couple years. But I was at an elder law convention as a vendor, and a lot of the, Midwest, Southwest, not in the big cities. I said, well, who does your care manager? Because they didn't know what an aging life care manager was either. And they go, oh, we just send somebody from the office. And I'm like, well, you need aging life care managers.
Oh,
Some of the law offices here that have care managers, they oversee, but once they see the depth of what some needs are, then they might refer out. And then we, report to the law office also when reporting to the family if we have consent, because they can't be as hands-on all the time, depending on how the law office is set up.
Yeah.
Judith has a good question. When do you recommend starting a relationship with an aging life care manager? Before moving to a independent living or CCRC? And this is a good opportunity for y'all to comment on how a lot of people are now coming to you all and developing that relationship while they're healthy and active, and maybe checking in once or twice a year. Talk about that, but everybody's different, Judith. I mean, but the sooner the better, in my opinion.
I have a lot of people in our area because we're getting saturated with retirement communities and CCRCs, and that start with before they make the decision. Or they'll say, or bring me to the house, what do you think? Can I age in place? Yes or no? What are the pros and the cons? And what do you think we should do? So sometimes it's one visit where you'll say, you're in a 4-level townhouse. I don't think you could age here. So, but it's very individual, but the sooner the better.
Well, and actually, Maria, you teed up this next question from Ali, who I happen to know is a universal design and remodeling expert. And he was wondering, how much construction knowledge do your firms typically have or develop over time when it comes to modifying people's homes? I'm curious how much hands-on understanding you gain to form realistic solutions to make their homes more safe and accessible. Good question, Ali, and a real important thing for folks who are aging in place, because sometimes their environments aren't really safe.
I refer to somebody like Allie. that because for the stair lifts, for the, grab bars, everything like that.
Mhm.
We don't
When we're
have that
doing an
expertise, I don't
assessment,
think.
if there's a way for someone to live on the main floor, but they don't have a full bathroom, we might look and say, it is possible if you consult a professional.
Mhm.
Because that's the thing. Oh, I should have done this renovation. I should have done this. And I said, it's not too late. Ideally a practice that has an OT or somebody familiar with the needs. But I think we all do rely on them. We have a company here. They just come in and do a full assessment of the house, and the person can pick and choose what they want.
And we do home safety evals, and we have a physical therapist who also has a huge background in pain control.
Mhm.
And we do a joint visit with him and identify what issues there are. And I mean, there was one that was easily solved by a particular kind of bath bench. That was kind of the key to it all. And then they would need a ramp at some point in time. But we bring in the experts to then deal with the issues. A lot of times the recommendation is to move into a more compatible environment. And especially a lot of times it has to do with having caregivers available. But we do a lot of home safety evals.
Mhm. And we have an occupational therapist on our staff too. So it's really good when a nurse or social worker goes in, we can call the OT. Give me more ideas.
All right.
And there's so many tools out there. I had a client, she put in a bathroom on the first floor, but then the lip, when her husband was wheelchair bound, and we were able to find something that you just put on that lip that lets the wheelchair go over. So there's a lot of resources, for people to age in place.
Yeah.
So folks like Ali, occupational therapists are helpful in this space. There's a certification called Certified Aging in Place Specialist, but I'm glad he brought that up because it's more than just having like a home care provider in your home. It's getting the environment to be safe as well. Okay, I'm looking at the clock. We got about 4 minutes left. Let me scan through some of the questions here. And I think I saw a really good one that I wanted to ask y'all. Whoops. Where the um oh, what about okay. Oh, describe how you interface with end-of-life professionals, hospice nurses, doulas, patients that may require medical aid in dying. Any experiences in end of life?
We work with hospice all the time, and a lot of times we're in first and then bring hospice in. And we really don't do the same thing. We work really well. We figure out what the needs are, plan together. And I mean, I guess in that way we have more of like a family role. I mean, we make sure that there's communication, that there's coordination, that there is food in the refrigerator, that the supplies are all there, that like the hospices provide almost everything, but they don't provide wipes. Well, wipes are important, and we make sure that there's a supply of wipes. I mean, so all of those little things, big and little, but we work hand in hand with hospice.
Yeah.
We collaborate really well.
Yeah. I think also often we as care managers are the one educating the family about when it's time for hospice. Like I had a call from a doctor today, just so you know, I'm going to be having the conversation. Can you follow up with this? Or I had a facility, they were talking and she was in and out of the hospital. I said, do you think it's time? They said, yes, but we don't think we can have that. And so we would be the ones helping introducing the right hospice company.
I love it. Okay, I'm going to close on this last question from Jenny. We've never had this question, and I'm curious about it, Jenny, too. Have any of you agreed to be a durable power of attorney and had the client run out of money? If so, what did you or what happened in this situation?
I mean, I had that case happen, but I knew that the money was going to run out. So we had kind of planned, made sure they were in the right place. And the family did, with the help of a lawyer, set aside some money for care management in the event that the person needed it. Or sometimes families will pick up a once a month visit just so they have a partner. I mean, it happens. We have clients that go on Medicaid. And so we try and work, within their means, because some of those relationships might on Medicaid that's been 6 years now.
Right.
Yeah.
Yeah.
Yeah, and that's the key thing, folks, is that if you start doing the math and you see that, over, 12 month, 3 years, 4 years, doesn't matter. If I'm spending at this rate, I'm going to run out of money. It's really important to do that Medicaid planning in advance, make sure that you're in a place or that you can get to a place where Medicaid is going to be approved and your loved one or yourself can continue care. Well, holy cow, this has been another great discussion. I love having these discussions. Y'all were great, had some great questions this month. Any sort of final thoughts, anything that y'all wanted to share that you were unable to share?
We didn't get to thank you, Steve. So thank you very much
Thank
for
you.
allowing us a
Thank
chance.
you.
Thank you. Well, thank you all too. I really enjoyed this, and folks, I will get the recording up later this evening or afternoon, and then I hope everybody has the remainder of a great week. Great week.
Thank you.
Thank
Steve.
you. And
Thank you.
don't hesitate to contact any of us. We'll be glad to
Yep.
answer any questions.
And I'll have all your
Absolutely.
emails on the recording link. Thanks, Marie.
Thank
you.
Okay.